The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, vitamin C and cancer. Your presenter, Hugh Riordan, MD.
Well, welcome. Welcome to each and every one of you, and especially to the Cowley County Health class. Is that what it is? Welcome. Glad to have you here. Here's a little glimpse of the center staff, including our research team, without whom I would not be able to make this presentation at all. Their support and dedication are really wonderful to behold. I applaud your attendance at this lecture, demonstrating your interest in learning anew, suggesting you embrace the observation of the Greek philosopher Epictetus, who taught it is impossible for anyone to begin to learn what he thinks that he already knows. Before presenting material directly related to my topic, I would like to share a Reuters news release of December 8, 2003, which quotes Alan Roses, the worldwide vice president of genetics at GlaxoSmithKline, which is the largest pharmaceutical company in England, stating fewer than half of the patients prescribed some of the most expensive drugs actually derived any benefit from them. It's an open secret within the drugs industry that most of its products are ineffective in most patients, but this is the first time that such a senior drugs boss has gone public. Dr. Roses, an academic geneticist from Duke University in North Carolina, spoke at a recent scientific meeting in London where he cited figures on how well different classes of drugs work in real patients. They vary from 60% to 25% for cancer drugs. It's important to realize that every life is very different, which makes it unrealistic to believe that how other people respond to a particular treatment or has anything to do with how another person will respond. Our immune systems are different, our energy levels are different, our support systems are different, our tissue health is different. What we are made of makes a difference. As pointed out by the psychologist Dr. Rollo May, by way of example, he said about response to illness or injury, imagine that we have 3 dolls, one made of clay or porcelain, one made of plastic, and one made of steel. Hit all 3 with a hammer, and the results will be quite different. The clay or porcelain doll will shatter, the plastic doll will dent, and the steel doll will give off a musical note. So those of us who work with people who have cancer or other malfunctions of their physiology have the first task to build their resistance, to allow them to become stronger over time, which requires patience. One of the ways we do this is to improve their nutritional status. Abe Hoffer who's a physician, PhD, MD, who's now 87, I believe, in Victoria, British Columbia, has done this for many years. He has chronicled much of this in a book, Smart Nutrients, in an effort to demonstrate to the usual medical mind that nutrients are important for well-being. We have visually demonstrated that the lack of a single nutrient dramatically affects rodents, such as rats. Here are 2 rats. A rat fed a regular chow, and the other fed a perfect chow, with the exception of vitamin B6. Look at what happens to the skin of the paws, the snout, the tail, and since I give quite a few presentations to psychiatrists who are Freudianly oriented, the penis. So obviously gene expression changes when even a single nutrient is withheld. In this case, vitamin B6. What we saw was obvious. I would like to digress here about gene expression research because what we are doing is so fresh and hot. I want to share with you a little bit about what is involved. I and our researchers wondered how much effect the lack of a single nutrient would actually have on gene expression. You know, of course, any serious illness has a gene or multiple genes connected with it. And it's not whether or not you have the gene, it's whether it's turned on or off. The Biocommunications Research Institute, in cooperation with the Kansas University School of Medicine, agreed upon a plan to determine how much gene expression was affected just by the lack of a single vitamin, in this case vitamin B1 or thiamine. It was the first one to be analyzed. Rat RNA changes with nutrient deprivation is the topic. It's widely believed that thousands of genes and their products, RNA and proteins, in a given living organism function in a complicated and orchestrated way that creates the mystery of life. However, traditional methods of molecular biology generally work on a one gene in one experiment basis, which means that the throughput is very limited and the whole picture of gene function is hard to obtain. The development of reliable automated sequencing techniques made possible the growth of genomics as a commonplace element in modern biology. 10 years ago, the invention of the polymerase chain reaction, or PCR, produced a surge in new experiments. In the past several years, new technology called DNA microarray has attracted tremendous interest among biologists. This technology promises to monitor the whole genome on a single chip so that researchers can have a better picture of the interactions among thousands of genes simultaneously. Here's what the little chip looks like. And the potential uses have to do with gene discovery and disease diagnosis and drug discovery and toxicology research. And from my standpoint, most importantly, the impact of nutrition on genes. The whole quest is very multidimensional. Arrays are used to look at thousands of genes. The first gene expression study that we did has 1,000 pages of these. Obviously, we're hiring a med student to analyze these. That's just looking at liver genes. What happened with vitamin B1 withholding in liver genes? Anyway, we have some conclusions, which are fairly easy. Nutrients speak to the genes. The results of nutrient deprivation are not subtle, and we are just beginning to analyze the results, so stay tuned. This work, in my opinion, will put nutrition at the forefront of medical thought where it belongs. We wondered, would one gene, 3 genes, or 5 liver genes be affected in their expression by withholding vitamin B1? I'm still amazed. Just by withholding thiamine or vitamin B1 for 41 days, how many genes in the liver tissue were up or down regulated, which means turned on or off and changes? Not 3 or 10, and your guess. More than 600 genes, liver genes, were upregulated, and more than 1,000 were downregulated. Does nutrition make a difference in our gene expression? You bet. When I was a medical student some 50 years ago, in order to give anyone more than 8,000 units of penicillin, it was required to have the chief of medicine present. Obviously, very few people ever received more than 8,000 units of penicillin. Today, of course, we think nothing of giving 2.6 million units of penicillin in a single injection. I believe we are in the midst of learning that higher doses of vitamin C are effective, just as we learned higher doses of penicillin are useful therapeutically. When I started using vitamin C orally to enhance the well-being of individuals with cancer, a dose of 10 grams was thought to be enormous. Similarly, an early paper on the subject of AIDS revealed that the researcher believed the most effective treatment for AIDS was vitamin C. However, it would take a dose of 10 grams ingested orally per day, which researcher Jeffrey Lawrence thought was too great to administer because it, quote, would be too toxic. Now we know that amounts much greater than 10 grams orally or intravenously are not toxic. 29 years ago, when we first started giving intravenous vitamin C, it was what was considered a huge dose of 15 grams. I would sit with new patients during their first infusion, hoping they wouldn't die while they were receiving their first intravenous vitamin C. 2 years ago, that same scenario was repeated in Puerto Rico by a courageous oncology surgeon as she gave the first infusion of vitamin C to her patient with extensive terminal cancer. She was startled by the excellent results. The patient, who was the uncle of another oncologist, had not eaten or spoken for 2 weeks before the first intravenous vitamin C infusion. Before the infusion was completed, he started to talk, and on the way home, he said, "I'm hungry and want pizza." After 2 weeks of higher dose intravenous vitamin C infusions, he was not only cooking for himself, but for friends and socializing in the neighborhood. His oncologist nephew said he didn't care if the vitamin C did anything for his uncle's cancer because it was so wonderful to see him feel so much better with an improved quality of life. However, he was interested just to see what had happened to his uncle's CEA, which of course is a cancer marker. 1 month after starting the infusions, his CEA dropped from 680 to 60. At the center, where you are, which I'm privileged to direct, we have given a great deal of intravenous vitamin C. Much to their credit, the National Institutes of Health have recently published a study in the Annals of Internal Medicine in which they demonstrate intravenous vitamin C raises the plasma level significantly farther than taking it orally. In their paper, they only gave 1,250 milligrams of vitamin C, but the results were quite impressive anyway. Here are their graphs of what they gave. It's a little hard to see, but the background of giving it was that vitamin C at high concentrations is toxic to cancer cells in vitro, or in other words, cell culture. These are the researchers that were involved in it. I was pleased to be among them. The objective, this is just a statement that vitamin C at high concentrations is toxic to cancer cells, which I just said. The objective was to determine whether plasma vitamin C concentrations vary substantially with the route of administration. In other words, is it different if you take it orally or if you take it intravenously? The results, peak plasma vitamin C concentrations were higher after administration of intravenous doses than after administration of oral doses. And the difference increased according to the dose. Conclusion, oral vitamin C produces plasma concentrations that are tightly controlled. Only intravenous administration of vitamin C produces high plasma and urine concentrations that might have anti-tumor activity. Of course, we at the center know a lot about the pharmacology of vitamin C and its pharmacokinetics because we've given it for 29 years. Here, I just want to show you some examples of levels of plasma vitamin C after infusion. This is among 488 patients receiving 15 grams of vitamin C. Here's a group of 355 patients receiving 25 to 45 grams. Here's a group of our patient co-learners who receiving 50 grams. And this is 306 people receiving 60 plus grams. That's how high their levels go. All total, we have administered or supervised the administration of well over 200,000 grams of vitamin C at our center and throughout the world. We have also learned that vitamin C is indeed a very potent antiviral agent. If I had any viral-initiated disease, including infectious mononucleosis, which some of our college people might be interested in, high-dose intravenous vitamin C would be the first therapy I would choose for myself. In our experience, the symptoms of acute infectious mononucleosis and the commonly experienced sequelae are eliminated by a few infusions of vitamin C. Hepatitis C also responds well to a combination of intravenous vitamin C, lipoic acid, and selenium. And even our colleagues in Malaysia have found that intravenous vitamin C is effective for treating poisonous jellyfish stings. To increase your awareness of the many benefits of vitamin C, I suggest that all doctors and anyone with interest read the excellent book by Dr. Thomas Levy titled Vitamin C, Infectious Diseases and Toxins, published in 2002. At the center, we have demonstrated that high-dose vitamin C in conjunction with other nutrients, following a thorough evaluation, can significantly increase the quality of life of people with cancer and in some cases entirely eliminate the cancer. I could report to you many case studies of people who were able to eliminate cancers by using only intravenous vitamin C and other natural substances. Like the lady from Wisconsin who came to us in October years ago with 8 lung metastases, hoping we could keep her going until Christmas so she could go to Florida in that year. 1 year later, she was down to 1 metastasis, and 4 months after that, her lungs were totally clear and remained so for years. She said that the reason she got rid of the last metastasis was not the vitamin C, but because I sent her a dozen roses when 7 of the 8 metastases had cleared, and that well might be so. Or we could mention the lady with lymphoma who refused chemotherapy and took intravenous vitamin C instead. First, her tumors got larger and softer and then disappeared. That was 9+ years ago. Or we could talk about the successful businessman with bladder cancer who was told if he didn't do chemotherapy, he would be dead in a few months. He decided upon high-dose intravenous vitamin C instead. Today, 7+ years later, he has the appearance of a very healthy, kind of a bronze Adonis. He looks great. Or we could talk about the lady from Montreal who became an excellent N of 1 case. N of 1 means, you know, you start a treatment, you stop a treatment, you start a treatment, stop. So you're your own treatment. You don't have a group, you're just yourself. She was initially evaluated at our facility in 1993 with a diagnosis of metastatic disease from a kidney primary, which had been excised earlier. She had metastases in both lungs. She was started on intravenous vitamin C therapy and returned to Montreal with instructions to continue the infusions for 1 year. You understand, no matter what therapy you have, whether it's chemo, radiation, anything but surgery, which of course removes the tumor, you need to understand that only about 1/3 of the cells are metabolizing at one time. So 2/3 don't care what you're doing, whether it's vitamin C or not. You need to keep after it. So 3 years later, in 1996, she called to say her metastases were growing again, and that contrary to our advice, she had discontinued the intravenous vitamin C after 3 months because the metastases had stopped growing. We reinstated the intravenous vitamin C therapy again with instructions she was to continue the treatment for a year. 3 years later, in 1999, this is 6 years after first seeing her, she called with the same message. Her metastases were growing again. In 1996, she stopped the vitamin C therapy after 4 months because the metastases had stopped growing. This isn't funny, but it is. The same story was repeated in 2002, and she again resumed vitamin C therapy. Anyway, her on and off use of vitamin C intravenously has provided us with a rare glimpse of the effectiveness, at least in this case, of retarding metastatic growth, but she has finally succumbed 11 years later. What is really exciting to learn also is the use of intravenous vitamin C by doctors in other areas, many of whom have come here to learn what we do. Here's one page of a paper by a Korean physician. This is a blast or blood cell response showing the drop down. This was a Korean physician who taught in this country for 15 years. He's a leukemia expert, that anyone with leukemia should not take vitamin C because it made leukemia cells stronger and more difficult to kill. Now he teaches that everyone with leukemia should receive intravenous vitamin C. Here's a paper by another Korean physician, Dr. Yum, chronicling a remarkable response to intravenous vitamin C. And from our own country, another paper indicating positive responses to ovarian cancer using vitamin C. Now again, to gain perspective, I would like to compare the outcomes of 2 ladies diagnosed with breast cancer with positive nodes. The first was a public health nurse who opted for our treatment after a lumpectomy. She still survives now 18 plus years later. She had some personal issues which we thought should be resolved as part of the process of getting well, and they were taken care of. The second lovely lady came after surgery, chemotherapy, radiation, and therapies from around the world. Years before the diagnosis, she found her professional husband in bed with another woman in her home. Subsequently, there were other infidelities which the patient chose not to confront or resolve because, quote, of the children. I would just like you to imagine how that approach reduces the effectiveness of one's immune system. She's a good example of someone who could not take enough intravenous vitamin C to overcome her disease. She has made her transition from life as we know it. I mentioned her to emphasize that woman or man does not live by vitamin C alone. The safety of continuous intravenous vitamin C administered 24 hours a day by pump for 8 weeks was confirmed in a phase 1 study at the University of Nebraska School of Medicine completed more than 5 years ago. We are still waiting to have the paper published. In our own facility, the highest dose of intravenous vitamin C administered to date is 200 grams or 200,000 milligrams over a 5-hour period. I have personally received that amount on several occasions, as have others. Now let me share a little bit about my odyssey in order to give you a glimpse of how I became interested in vitamin C as a therapeutic modality. My early odyssey and subsequent experiences have sustained my interest in the therapeutic benefits of vitamin C over the span of nearly 3 decades. Now, I was not born with an interest in vitamin C. In fact, my first real awareness of the substance, which is essential to human life, came in the early 1950s when I was a pre-medical student at the University of Wisconsin. Because of a severe sore throat, I went to a very knowledgeable doctor who diagnosed streptococcal throat infection. He offered me 2 options. One was aureomycin, the new antibiotic of the day. He said would clear up my problem in 3 to 4 days. Or he said I could get rid of my streptococcal throat infection in a week by taking vitamin C. As a student living in near poverty, the choice between $7 for the Oreomycin, that'd be cheap these days, and 50 cents for the vitamin C was easy for me. I chose the vitamin C, and all my symptoms cleared within 6 days. Then in the late 1970s, I discovered something which amazed me. For many years, for research purposes, my plasma vitamin C was checked on a regular basis. It was always in the normal range, fluctuating between 1.3 and 1.7 milligrams per cent, until the time when I had a spider bite on my left thigh. The next morning, I was scheduled for my periodic vitamin C determination. The laboratory called me to report that no vitamin C was detectable. After making sure that was not a lab error, I thought, well, I'll fix that, and had one of our nurses give me 15 grams or 15,000 milligrams of vitamin C intravenously. To satisfy my curiosity and to determine the effectiveness of the intravenous vitamin C the next morning, my plasma level was rechecked. Again, to my amazement, no vitamin C was detectable, and none was detectable each morning for the next 4 mornings, even though the previous day I would have had another 15,000 milligrams of vitamin C intravenously. Only on the 5th morning, when the bite was well on the way to resolution, did my plasma vitamin C begin to rise into the detectable but scurvy level. And it was several more days before my plasma reached its usual adequate vitamin C level. The spider bite episode led me to start measuring vitamin C in people on a regular basis. We evaluated sizable groups like nurses before and after an 8-hour shift, athletic teams during practice and before a game, and police rookies after an 8-hour shift. These studies showed that it is apparently very easy to deplete one's vitamin C just by engaging in what for them was their usual work or activity. One police officer particularly stands out in my mind because at the end of a night shift, both his urine and plasma had no detectable vitamin C. In addition to the very large stresses encountered by police officers, he had a rather deficient dietary intake during his shift. I vividly remember during his busy 8 hours, his intake was 3 cups of coffee, 2 cola drinks, and a chicken wing. As my good friend and mentor until his death, Dr. Emanuel Churaskin often said, most doctors believe people are not deficient in vitamin C because they never measure it. Thanks to what I learned first by happenstance and then by measurement, my vitamin C consciousness has been forever changed. From believing we're adequately fed and therefore have enough vitamin C, you, like I, may have adopted a more reality-based awareness that a significant portion of our population does not get enough of this nutrient. According to the latest United States statistics, most Americans do not even get the current RDA of 60 to 75 milligrams. It's changing a little bit. If you live in Canada, it's only 40. Apparently, if you go over the border, something happens. Anyway, according to the latest government statistics, the percentages of the population over 20 who do not receive the recommended daily ounce, which is a very minimal kind of thing, is in this country, for males, 39.4%, and for females, 43.9%. I've just received notice that the British are saying that all of our RDAs for vitamin C have been calculated in error and are way too low. I will mention that Dr. Mark Levine at the National Institutes of Health, whose work we discussed earlier, has made great strides in determining that normal young males under normal circumstances require 200 milligrams of vitamin C daily rather than the long recommended amount of 60 milligrams per day. Obviously, the amount necessary for a healthy person would not be sufficient for an ailing person, or as mentioned, for a person with a spider bite. In 1989, we began our RECNAC cancer research project. We started by by reviewing 5 decades of cancer research. What surprised me as we continued our search was the excellent work of Benet et al. At the National Cancer Institute, published in 1969. Benet et al. Were able to demonstrate the preferential toxicity of vitamin C to tumor cells, which were Ehrlich's ascites carcinoma cells. Tumor cells contain between 10 and 100-fold less of the enzyme catalase than do normal cells. Because there is so little catalase in the tumor to quench the peroxide produced by the vitamin C, toxic products build up and ultimately destroy the tumor cells. Today, there are other thoughts as to what the mechanism is. They were so impressed with this and enthused about the findings that they had this quote. In our view, the future of effective cancer therapy will not rest on the use of host toxic compounds, now so widely employed, but upon virtually host non-toxic compounds that are lethal to cancer cells, of which ascorbate represents an excellent prototype example of a number of potentially effective combinations now under investigation, unquote. And that was in 1969. We have done a great deal of research into the pharmacokinetics of vitamin C and can provide that information to anyone that is interested. Depending on your orientation, the cases I mentioned can be viewed as meaningless anecdotal reports or as important case studies. Hopefully, when appreciated together, these cases will increase the plausibility that high-dose intravenous vitamin C is useful in improving the quality of life and longevity of people diagnosed with cancer or sarcoma. To keep my perspective, I write little books on medical history titled Medical Mavericks. After all, if William Harvey couldn't get colleagues to believe blood circulated because another physician, Galen, said it didn't, why should I be concerned that colleagues do not yet appreciate how providing high-dose vitamin C may enormously benefit the patients they serve? I simply take comfort in the wisdom Linus Pauling provided me when, at the time of this picture, I asked him how he stood all the attacks he endured because of his belief in the therapeutic values of vitamin C. He said, "You just have to realize, Hugh, that when your colleagues aren't up on something, they tend to be down on it." In one of the medical Maverick vignettes, I recount how physicians as early as 1590 recognized the value of citrus fruits in preventing and treating scurvy. And even though Dr. John Woodall published in 1617 in the Surgeon's Notes his advice of carrying lemon juice on voyages to prevent scurvy, more than 1 million sailors died of scurvy in the next 200 years. In 1753, Dr. James Lind published his studies performed on the crew of the Salisbury, demonstrating that citrus fruits effectively treated scurvy. His treatise on the scurvy went unnoticed, and Lind went unheard. 40 years after his death, in 1794, his concept for the prevention of scurvy was finally put into practice. I can only hope that unlike the response to Lind, that you and any physicians present will be moved to discover for yourself how high-dose intravenous vitamin C might be useful to people who would benefit from it, prolonging and improving the quality of their lives. It is not easy to go against the tide of established medical belief and not swim with the group. It is not easy to offer a new strategy which must be judged by colleagues who are not educated in the new strategy, however beneficial it might be. But it can be exhilarating to do so. I do so buoyed by the truth of Malcolm Muggeridge's observation that only dead fish swim with the stream. That's kind of the end of that. I thought we'd take a few minutes just to make sure that the questionnaire, as you know, if you've been here before, I don't spoon feed you. you get a questionnaire that you have to fill in the blanks, pretty much. So I thought we'd just go through that very quickly. 1, the Greek philosopher Epictetus taught, it is impossible for anyone to begin to learn what he thinks he already knows. Number 2, the answer is fewer than half, according to Dr. Rose's benefit from the medication they receive, and in cancer it's 25%. Biochemically, number 3, we are blank. What are we? Different. Right, we're different. Number 4, the name for vitamin B6 is pyridoxine. Pyridoxine. Which of the following are symptoms of vitamin B6 deficiency? Craving for garlic, poor wound healing, depression, skin problems, all of the above. Actually, everything but craving for garlic. Apparently it doesn't do that. Which of the following are symptoms of B6 deficiency? Dry, cracked hands, scaliness around the nose and behind the ears, numbness in the arms and legs, and the answer is all of the above. Which of the following are also symptoms of B6 deficiency? Anemia? Yes. Fatigue? Yes. Desire for chocolate? No. Erratic blood glucose level? Yes. Number 8, true or false, vitamin B6 and zinc tend to work in tandem. That's actually true. What is the common name for vitamin B1? Thiamine. Very good. What is the name of the classic disease of thiamine deficiency, which we didn't talk about? Anybody know? Beriberi. Right. Number 11, true or false, nutrients affect gene expression. True. It's really important to understand that everything you put in your mouth, food or fluid, talks to your genes. Number 12, the capacity to switch genes on or off is called, which we haven't discussed that too much, it's an epigenetic phenomenon. In other words, it doesn't matter just that you have the gene, it makes a great deal of difference whether the gene is turned on or off. I hope you know the most recent research out of North Carolina is that as nutrient levels go down, viral potency goes up. So that's really quite an important finding. Illnesses that require one or more nutrients may be classified as, anybody know that? Genetotropic diseases. It's a term coined by Dr. Roger Williams when he was at the University of Texas. Genetotropic means you have vastly increased need for certain nutrients, which can be found out by testing. How many genes were upregulated by withholding thiamine from the rats? These are liver genes. 600, right. How many were downregulated? 1,000. This is a staggering number of genes. True or false? Number 16. Right. Number 17. The range that you get normally taking any amount by mouth is 2 to 4 milligrams % 18, high-dose intravenous vitamin C can achieve plasma levels that are blank times higher than is achievable by taking any amount orally. And that is 100 times higher. 19, true or false? Very good. 20, intravenous vitamin C is the answer for 20. 21, hepatitis C also responds well to a combination of intravenous C, lipoic acid, and selenium. Number 22, blank can enhance the tumor toxic effects of vitamin C. That's actually lipoic acid. There are many other factors. Yes, lipoic acid can enhance the tumor toxic effects of vitamin C. We didn't have time quite to go into that.
Did you say lipoic, glycolic?
Lipoic. Lipoic. POIC. It's a potent antioxidant. It's very good for diabetic neuropathy. It's good to keep blood sugars down, all sorts of things. The highest amount of vitamin C given at the center has been blank grams, 200 grams. That's 200,000 milligrams. 24, true or false? Dr. Riordan, you know that one? Oh, you've been listening. Very good. The USRDA for vitamin C, this is varying now, 60 to 75 milligrams, depends. They're fighting that out. 26, according to the most recent U.S. government statistic, what percent of Americans over age 20 do not get the RDA of vitamin C? And it's more than 20% would be the answer, because it's 39 to 43%. Number 27, Dr. Mark Levine suggested we need how many milligrams of vitamin C per day? If you're a healthy male doing nothing, not stressed, not driving anywhere, not sick, so forth. 28, true or false, vitamin C helps build collagen. We didn't quite have time to go into that. Collagen, again, is the substance that holds us together. It's the only reason you don't fall apart all the time. And building collagen, if you have a weak back, for instance, I think studies at Tulane Medical School 40 or 50 years ago showed that people that have back problems usually are low in vitamin C, and the collagen is weak and not holding things together. And the collagen, of course, is very important in relation to wall activity, because you want to wall off the tumor if at all possible, and it's the collagen that does that. True or false, vitamin C enhances immune function? That is true. True or false, high-dose intravenous vitamin C does not cause kidney stones? That's true. Much to their credit, the American Medical Association, in their big tome on alternative medicine, has a little piece in there about where the notion came from that vitamin C caused kidney stones. And they found out that no one ever did research about it. One person thought that it might do that, and it was repeated over and over again. The fact is, if you have familial stone formers, those that take more vitamin C will make fewer stones than the ones who don't take vitamin C, which they also quote in their study. For those of you who are interested in experimenting, you can pee in a clear cup and put in a little soda bicarb, and you'll see everything precipitate out. Put in a little vinegar, and you'll see, which is the equivalent of the vitamin C, you'll see it all dissolve. Very, very simple experiment. So as you acidify the urine, which vitamin C would do, if you're taking enough of it, it'll prevent things from coming out of solution. Nice, simple task. Linus Pauling was a huge supporter of the use of vitamin C for the common cold and other ailments, for which he was strongly blank. Criticized, yes. When asked how he stood up criticism, he said, you know the answer, right? If you're not up on it, you're down on it.
The preceding program was produced by the Center for the Improvement of Human Functioning International, Incorporated, and the Bright Spot for Health. For additional information concerning health or a listing of audio and videotapes dealing with health, visit the Bright Spot for Health website.